Hey everyone, we're back with another digital specimen walkthrough today. Of course, we're using the Cardioscape app, which can be downloaded at learnchd.com or cardio-scape.com. Remember, it's available for Mac OS as well as Windows. We don't have an iOS or Android version yet, although that is in the works. So be sure to check it out. Remember, it's completely free, so you've got nothing to lose. Download it, try it, and if you like it, keep it and tell your friends. But today we've got a specimen that was requested by Micah, who's a cardiology fellow at Nationwide Children's. And so we've got a heart with Scimitar syndrome. And so we'll take a look at this. The heart would have sat roughly in the chest like this. Here's the anterior surface here. Superior head would have been up here. Inferior legs down here. Left would be over here. Right would be over here. You can see here's the trachea, which is still attached to the heart. And then we've got the left lung here, which you can see is nice and large. So here is the left lung. And then we'll go over to the right side, and this right here is actually the right lung. So that's the right lung from its more anterior surface. If we go to the back, here's the right lung here, the posterior aspect of it. And then here's the left lung. So you can see how different in size the right lung is compared to the left lung. So a very hypoplastic right lung. Now, if we go to the heart, we'll find the right atrial appendage like we usually do. And here's what appears to be a pyramidal or triangular or broad-based appendage, at least externally. So we would expect this to be a right atrial appendage. If we zoom into this, it does appear to have pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We also see the oval fossa here, which does seem to have a defect in it. So an oval fossa type atrial septal defect. Then we come down and we see that here's the inferior caval vein opening up into the right atrium. Here's the coronary sinus here, the tendon of Totaro here. And so we do have two structures that delineate or demarcate the triangle of Koch, which remember is an important structure as it at its apex is where the atrioventricular node lives. But more importantly, when we come back to this inferior caval vein here, we see that there's this structure that connects and drains into the inferior caval vein from the right lung. And this, in fact, is the right lower pulmonary vein that's draining into the inferior caval vein. So why don't we zoom out for a moment, just get our bearings again. Here's a right atrial appendage. Here's the anterior surface of the right ventricle. Here's the pulmonary trunk here. We'll go further over to the right side. Here's the right lung, which is hypoplastic. And from the right lung comes this right pulmonary vein that drains into the inferior caval vein that then drains into the right atrium. So anomalous connection of the right lower vein to the right atrium, consistent with Scimitar syndrome. That explains why there is such a hypoplastic right lung as well. Otherwise, here's the anterior surface of the right ventricle. We don't have that exposed. Here is the pulmonary trunk right here. And then, of course, the ascending aorta, the transverse arch, and then the descending aorta back here. And then we don't have the left ventricle open or exposed, but here's the posterior surface of the left ventricle back here. So a heart with Scimitar syndrome with an anomalous right lower pulmonary vein draining to an inferior caval vein, which drains into the right atrium.